But there is a much bigger health risk in areas affected by Harvey. Let's go back to Norah in downtown Houston for that.
Thank you, Margaret. That's right. The devastating floodwaters in Texas are raising several major health concerns this morning. More than 17,000 people are in shelters. More than 8,000 of them are here in Houston's main convention center. Health hazards in this disaster are mounting both in the short and long term. Dr. David Persse is the physician director of Houston's EMS and Public Health Authority. Doctor, thank you so much for joining us.
Thank you.
I know this has been declared a public health emergency here in Houston. When you have people trapped in floodwaters, what's the big concern?
Well, there are a number of concerns. The first one, the immediate concern is somebody's going to be walking through and step on something or not step on something. For instance, if there's a manhole cover missing, so people are going to be badly injured walking through the floodwaters. It's always dangerous. From a health standpoint, we worry about the organisms that may be in the water and the chemicals that may be in the water.
8,000 people in this convention center. How do you avoid a health crisis?
When we have large numbers of people congregate in small spaces like this, we worry about viral illness outbreaks that would cause gastrointestinal problems. We always heard about the cruise ships where everybody got sick. It's the same virus that we worry about on the cruise ships that we worry about here.
The norovirus.
The norovirus, exactly. And that can be a real problem in a convention center where people are already, got all kinds of problems going on.
How do you prevent that?
So the biggest thing is there's two things. One is we have to really try to get folks to focus on their own personal hygiene, right? So the facility has to make sure that the bathrooms are kept tidy, so which means they need to be cleaned multiple times a day. So whatever the routine schedule is for the facility, it needs to be at least doubled in terms of cleaning. Also, we try to get the hand sanitizer throughout the facility so people will have it easily accessible to them.
Yeah.
Oddly, the one place you don't have hand sanitizer is in the bathroom, because you want people to use soap and water to wash their hands, not use the hand sanitizer, because soap and water is a much more thorough cleaning.
I walked through there. I didn't see a lot of hand sanitizer.
So getting the hand sanitizer up and distributed has been one of our challenges. We need so much of it. So the facility had some to begin with, but this is a crowd that is much larger than the facility is used to dealing with, especially at no notice.
It's Texas. There's lots of ants. We know that.
Yep.
What about mosquitoes?
So in the short term, I'm not too worried about the mosquitoes because all this rain is going to wash out all the breeding sites for the mosquitoes. And your average mosquito in the wild only lives for maybe a week anyways. So the pre-existing mosquito population will drop off, and then there won't be any new mosquitoes because the larvae all got washed away. But that'll be only about 10 to 14 days, and then we're having an explosion of mosquitoes because there's so much standing water, which is all breeding sites. So we'll be dealing with that in about 2 weeks.
Do you have Zika here?
We have people who've been here who have been infected with Zika in Central and Latin America. We've not had any local transmission here, but that is absolutely something that's front and center on our radar.
Dr. David Persse, thank you. Thanks to all the doctors and nurses and health professionals that are taking care of everybody. Thank you so much.
Well, thank you for being here.